vent lab airflow manual resuscitator, or ventilator, as some folks call them, manual ventilators. This is the adult size. So when you pull it out of the package, you'll want to expand it. It comes collapsed on the adult size. 7-foot standard tubing with this. Has a red fits-all connector on the end, so it's kind of a universal connector. So if you're missing your small bore tubing connector, or Christmas tree, as some folks like to refer to them as, if this is missing off your flow meter, you can still connect this the oxygen connector to the flow meter on the male connection. So you can do it whether this is on there or not. All right, so you don't have to hunt for a Christmas tree. All right, so 7-foot standard tubing. We have different configurations for our reservoirs. This is a bag reservoir. We have corrugated tubing reservoir if a hospital prefers it. So we can do different reservoirs. The bag reservoir will provide the highest FiO2 to the patient, but if for some reason somebody wants a corrugated tubing, we can do that. Slightly lower FiO2. All right. So tailpiece, bag body, the airflow manual ventilator has of course, a clear kind of transparent body. It's more of a vinyl type material, very easy to grip. Right. So if you have a gloved hand on, of course, which you will most of the time, you can grip this fairly easy. All right. So transparent, so you can see. You also have a swivel, so the patient valve will swivel separately from the bag, but also we have a patient swivel, patient connection port swivel for this bag also. The bag comes standard with a premium mask that has a valve on it to inflate, or if you want to partially deflate it, you can do that, but you can put as much air as you want to. So this is our premium mask. It also has the blow molded mask, which is missing the valve. So if a hospital would prefer to use the blow molded mask, we also have that option too. All right. Airflow resuscitator, manual ventilator, comes standard with a integrated manometer. Vent Lab has the patent for that, so we're the only one that can actually build the manometer into the patient valve. All right. So as you can see, the manometer is color coded. It's green from 0 to 20. It's yellow coloring from 20 to 40, and of course the red coloring from 40 and above. All right. So integrated manometer. Very important to have a manometer, whether using a pediatric or infant bag. We put these on our adult bags also, and there's different reasons to use a manometer, certainly. But you know, one of the biggest reasons is to prevent gastric insufflation when you're mass bagging your patient before they're intubated. Keeping the manometer in the green will prevent that from happening. It takes about 20 centimeters to override the esophageal sphincter. Once you do that, you start pushing air into the stomach and less into the lungs. Right. The other thing, since this is a manual ventilator, you know, if I need to do PEEP, I would place the PEEP valve on the resuscitation bag. All right, so I can provide PEEP. I have a manometer. The other thing we do with the airflow bag is, you know, it's a manual ventilator. It comes standard with the bacterial viral filter that fits on the exhalation port. And as I showed you on the PEEP, the PEEP valve can actually go on the filter. And if the filter is missing, it can still go on the bag on the exhalation port. Okay, so it will fit either way. All right. So bacterial viral filter, very important. You know, the manometer protects the patient. You know, you can limit pressure and do those things, but the filter protects the staff, protects other patients, and it protects visitors from what the patient may have. So that's the run through with the airflow manual ventilator. This is our